Hello, my name is Dr. I'm a Raspberian and I work with the World Health Organization in Nigeria on the Polio Eradication Initiative. I possess a master's degree in Public Health Management and Leadership from the School of Health and Related Research, University of Sheffield in the UK. I have worked in clinical medicine where I've treated and managed an array of patients with different ailments and in public health where I presently work. A major part of my work involves control of communicable and vaccine-preventable diseases through active surveillance and routine immunization. It isn't news that there are enormous challenges being faced on the African continent when it comes to healthcare, and these range from inadequate healthcare financing to poor access to health facilities, even to personnel motivation and remuneration. But what's common to all these is the dilemma of when a decision needs to be made at the right time. And essentially, the biggest factor that underpins the issues in Africa is a lack of information to drive these decisions.
Thank you, Dr. Oguniro. We also had a conversation with one of the project heads for the Lagos State Ministry of Health. Lagos State in itself being one of the tech-savvy states in Nigeria. And one of the core challenges that keeps him awake at night is how to identify health breakout issues as they occur. You might as well think Ebola, Zika virus. To quarantine and isolate, if necessary, to assign health workers to the right place, and to ensure that they are there to allocate drugs and other health resources to the right areas. Basically, the challenge is that of what, where. Our business idea will focus on the Raspberry Pi with USB 3G modems to connect remote health centers using private APNs to data stores. Now, the Raspberry Pi in itself is a mini computer, not bigger than two credit cards. It's available for about $35 today and has been used for several personal applications. We'll use it for two primary purposes. One, as a wireless hotspot. Two, with a 3G USB modem to connect over a private APN to the data store. Now, we also have a roadmap that includes application development, site management, for easier deployment and central control, application development into other areas like education, population measurement, project monitoring and evaluation. Also to develop a much more robust hardware overcoming some of the challenges with respect to scale on the Raspberry Pi. The United Nations in itself estimates that Nigeria has about 23,000 health points as of the year 2000. We believe that to be double by now. Our marketing strategy will be through the following two approaches. One, direct to the customer. Two, indirect through donor agencies and companies. We will generate revenue in three areas. Capital purchase of the core product, which is the Raspberry Pi and the USB 3G modem, will also generate income primarily from our subscription-based management service of the product. We'll also look at adjacent businesses to include data center rollout, data management and analysis, and total information management where possible. The team, we've got four people. Abiona Enito is a graduate of Coventry University and London School of Economics. He's also a Prince 2 certified project manager and will lead the project management effort for the project. Ope Ogundiro is a cluster consultant for the WHO in Nigeria and a graduate of public health at the University of Sheffield. He will lead strategy for the business. Acefo is a graduate business student at Imperial College, has worked as a human resource professional for top Fortune 500 companies. He will lead sales and negotiation and will drive business development and growth. I am a graduate business student of Imperial College. My name is Walo Waye. I have worked with Cisco Systems for the last 9 years and I will lead technology and product development for the team. £10,000 we believe will go a very long way to develop the product and put the team to market. We believe it will help us to build prototype solutions. It will also allow us to share these prototype solutions as part of our sales efforts with our customers and donor agencies. And we also believe that since we're dependent on subscription service, the fund should help us reach the first set of customers and our subscription service contracts should help sustain the company. We'll look at other grants from other agencies, not just for the funds, but also for credit.